Want a new way to punish your kids? Tell them if they misbehave, they'll have to read this. This is ObamaCare, otherwise known as the Patient Protection and Affordable Care Act. We're told this will make health care cheaper while also giving more coverage to more people. How can it do both? Well, it can't, but some people have so much faith in government control. I just wrote this book, refute the conceit of a better life through more government, but that central planning just appeals to people. We're imprinted to believe that our wise leaders can make things better. However, the doctors at the Association of American Physicians and Surgeons are skeptical about that. Their former president is orthopedic surgeon Dr. Hieb. Dr. Hieb, you're the rare doctor who actually knows what the phrase road to serfdom means. How did that happen?
I like to read history, and I like F.A. Hayek's ideas, and I like free markets versus government intervention.
Well, they do seem to work better, but this appealed to lots of people, the idea that we have to worry about paying for health care and other countries take care of you. Why isn't this better?
Well, I mean, other countries purport to take care of you. I mean, we have a lot of history in the 20th century, for example, the Soviet Union, that had free universal health care. But when Boris Yeltsin needed his heart surgery, who did he call? He had American-trained physicians. He went to a hospital only for the Politburo. Kind of reminds you of Obamacare, that is exempting all his friends. It's good enough for the gray masses. And the Soviet Union universal health care was good enough for the gray masses, but not good enough for Boris Yeltsin.
And what do you mean Obamacare, Obama exempting his friends?
Well, there are all these corporations now that are asking to be exempted from Obamacare.
And unions.
And unions, because they realize they can't afford it. I mean, as much as Obamacare is a problem, and everyone's concerned about the 2,700 pages in the bill, that if it goes away tomorrow, the problem doesn't go away tomorrow. Because the problem started in 1965 with the advent of Medicare and Medicaid that have grown into these monstrous vampire programs that's sucking the lifeblood out of the American people.
People like Medicare.
Well, people like things that appear to be free and easy until things collapse. But seniors are finding out that it's getting harder and harder to find a physician who takes Medicare, and ultimately government medicine fails, and when it fails spectacularly. I travel around the world and talk to people in different countries who have socialized health care, and I look at the data, and there's a difference between feel-good medicine and good medicine. You know, I believe medicine is between a doctor and a patient, not between a doctor and a government bureaucrat and a patient. And if you look at, for example, almost any marker that you want, survival cancer rates, they are significantly better in the United States. They may feel good in Finland that they have universal health care, but the 5-year survival rate with men with cancer in Europe is 47%. In the United States, it's 66%. That's not chump change. And so when the former Sultan of Brunei needed his cancer care, where did he go? He came to MD Anderson.
And when Michael Moore, after doing the movie Sicko, wanted to lose weight, he didn't go to a Cuban weight loss clinic. He went to a private clinic in Florida. But despite those examples, people say, you want to just dump the poor people? If you have a market in health care, that means if you're poor, you die.
Well, you know, I'm old enough to remember when healthcare was not run by the government. My father was the proverbial Marcus Welby. He practiced medicine in a small town of Iowa. People were not dying on the streets then. And the answer to medical care is what we did back then, and it worked. I call it the 3 C's of healthcare, and it doesn't mean you're dumping the poor. It's cash for outpatient care, because when you have cash, the price of things go down. Competition makes everything better. We have no competition in government monopoly, Medicare, or Obamacare.
So just to clarify that, cash, well, at first, the 3 C's are cash, catastrophic insurance, and charity.
And charity.
First, cash, that right now you just expect the insurance company to pay. A few people have these health savings accounts where they are paying their own cash, and they'll say to the doctor, gee, does it really need to cost that? And nobody's ever asked the question before.
Right.
And the doctor says, oh, you're paying cash now? I guess it'll cost less, and if you pay me now, and then they don't know where to put the cash because they have it in a cash box. But is that what you mean? Pay?
Oh, absolutely. And as example of that is LASIK. LASIK used to cost $5,000.
This is the eye surgery to correct your vision.
But because no insurance and Medicare doesn't cover it, it's cash. Now we have the same competent surgeons. We have better equipment. Just like in computers, the cost comes down per computing power. LASIK, the cost has gone from about $5,000. I see it advertised for $500. That's what cash does. I'm an orthopedic.
$5,000 to $500.
That's right.
But the quality's gone up.
Exactly. You know, if people paid cash for outpatient items and used what catastrophic insurance means is that it's only for big ticket items. You break your femur. You need long-term hospitalization for your heart failure. But we use our health insurance for every little proverbial oil change. You know, we go in with a little runny nose and we want to have our health insurance pay. It is so...
And this encourages more of that.
Of course it does. And you know, I had 7 employees. I was in a big orthopedic practice in Arizona. I had 7 employees, 5 of whom were there just to deal with the paperwork of billing these third-party payers. If it were just for cash, you could cut your costs way down. But now with government involved, they won't let you charge below a certain rate. So even if you come in and you're uninsured, the people they purport to care about, the uninsured, and I want to give you a really good charitable deal, I can't go below Medicare rates because that would be discriminatory against Medicare patients.
Your third C is charity. You really think charity would take care of the desperately poor?
You know, we used to run charity very well. It was your friends, your colleagues, your business organizations, your churches, the local communities took care of each other. But that goes away because we have this kind of government communal welfare idea now. You know, it's not charity when you reach into your neighbor's pocket and force him to pay for somebody else's broken hip. It's charity when you reach into your own pocket. We get the cost down through cash and the catastrophic insurance concept. You can afford to be charitable. It's easier to be charitable.
All right, I certainly believe that the free market will do everything better, but
Absolutely.
People will say to me, you know, it works for crass consumer goods, but for complicated things like healthcare, the consumer can't make a decision. The government has to take control. Healthcare is too complex.
Well, I reject that. I mean, I believe in the power. Your book is exactly right. The individual can do this. The government can't do this. I mean, I talk to business groups all around the country, and my first question to them is, when has government ever gone into your business and made it more cost effective? If it doesn't work for your business, it doesn't work for mine either. Because the basic economic laws, the ones that F.A. Hieb and the Road to Serfdom outline, they apply to medical care. Hayek. It applies to medical care too. We produce a service, and we produce goods and services just like other businesses. They may think it's more complicated, but it's become more complicated because of the 150,000 pages of Medicare regulation.
So next time they foist this on us, you're with me going to the state capitol with the sign saying no.
All the way.
Okay, good. Thank you, Dr. Hieb. Next, there is one part of America